Welcome to Barnsley CCG Annual General Meeting. My name's Nick, I'm Chair of Barnsley Clinical Commissioning Group. I've been Chair for 9 years. I'm also a GP in Athersley, where I've been a GP for 30 years. Firstly, because of some of the challenges that COVID has presented, I'd like to thank all the people of Barnsley for their help and support and cooperation with health and social care services. Without you, we couldn't have managed to sustain delivery of services. The way the public have come together to respect and carry out social distancing and COVID precautions has been exemplary, and that's really helped us. It's helped us safeguard you and our health and social care staff. I'd like to say thank you to all our colleagues in the health and social care services, and in particularly those in care homes who faced perhaps bigger challenges than some of the rest of us. It's been a bizarre year, one like no other, and one in which we face some of the biggest challenges I believe that the NHS may ever have faced. In coming together, it's allowed us to prioritise how we see people and who we see, and it's helped us to get face-to-face consultations with those people who need them. COVID is still here with us. We have not just new cases now, but we have old cases and long COVID. We have to face and deal with that. We also have, it's September, the winter is coming. There'll be a series of winter pressures when people get more poorly, and of course the flu season and a booster COVID vaccination programme as well. So the volume of work, the demand is not going to go down, the capacity is fairly fixed, so we're facing a few challenges together over the next few months. However, I think the way we've come together in Barnsley has been exemplary. If you think about it, last year when I did this filming, we were still waiting for a vaccine to be developed. Since then, today, we've given 330,000 vaccines in Barnsley, 1/3 So that's massive progress and massive protection for our public and healthcare staff, a tremendous achievement. The vaccination programme's been led by primary care, GP practices, our primary care networks and the GP Federation, who have come together to make this happen with support from many parts of our community health teams, the hospital and other sectors in the system. But particularly I'd like to say thank you also to our voluntary sector who are not paid. They come and volunteer and they've helped us. Some of the vaccine centres would not have been open if volunteers hadn't been there shovelling snow out of the car parks and the paths. So thank you for those efforts. Other illness stays with us apart from COVID, and in particular I'd like to talk about how we've prioritised cancer services. We've followed national guidance and we've prioritised people so that those people newly diagnosed with cancer have had diagnostics, have had diagnostic tests, have had their treatments as soon as possible and all been seen within 2 weeks. Also, we've concentrated on people who were already on a waiting list, making sure that they're not delayed inappropriately. At the beginning of the pandemic, the 2-week wait cancer service referral system, we did see a dip, but that recovered very quickly and we've maintained it, and in fact maintained it better than in many other areas. This year we've also relaunched our Breathe service, which supports people with chest conditions at home, helps them manage with treatment at home and support without needing to go into hospital. This is not only better for them, it improves their quality of life and it keeps them out of a place they don't need to be in. So that's been well received and we're proud of that. We've also maintained our mental health investment standard. As you'll all be aware, COVID has brought with it a lot of anxieties, a lot of stress, a lot of worries, and people's mental health has suffered. We've maintained our investment and increased some of the services that we have to support people with low mood, anxiety and other mental health conditions. So again, we're really proud of that, but that's been a joint effort with our mental health provider, primary care, voluntary sector, community sector, all of us working together. So, a busy year for us all. I think next year will be better. We need to continue to have our vaccinations and our boosters. If there are people out there who haven't been vaccinated, perhaps a chat with them and an explanation to them of how it will benefit them and those around them will be useful, and you could really help there. I'm going to close now by thanking you for all the help and support you've given us, and thanking our member practices, our CCG staff, our governing body members and partners in helping Barnsley through a particularly difficult year, but managing to do better than we expected and better than many other areas. So thank you.
Hello, I'm Roxanna Naylor and I'm here to present the financial accounts for the CCG for the year ended 2020-21. The CCG entered the year 2021 with significant pressures as a result of the global COVID-19 pandemic. A new financial framework was introduced by NHS England to support the NHS. This changed the allocation mechanism and supported the NHS and service providers in the delivery of services in this public health crisis. With this in mind, I'm pleased to report that the CCG delivered all NHS England year-end financial business rules. We delivered a small underspend of £195,000. We retained running cost expenditure within the allocation we received. We met the requirement for the mental health investment standard, which meant that we had to increase investment in mental health services, and we also increased investment into our Better Care Fund. Here's a look at the financial position. The CCG received total funding of £490.5 million. This can be broken down into the following areas. Programme services, £445.9 million. This is the funding to commission services for the people of Barnsley. This includes our hospitals, ambulances, community services, mental health services, contributions to the council, prescriptions and some primary care services. Primary care co-commissioning contracts, £39.4 million. These are the contracts held with GP practices to provide primary care services. CCG running costs, £5.2 million. These are the admin costs associated with the commissioning of services. Here's how the CCG spends the funding it receives. Hospital services, including ambulances and transport, £250.9 million. Mental health services, £37.7 million. Community services, £52.2 million. Continuing healthcare, £29.4 million. GP prescribing, £50.5 million. Primary care, £53 million. Other programme services, £4.7 million. And running costs, £4 million. Given the impact of the pandemic, we also incurred costs relating to COVID-19, which totalled £8.1 million. To put this into context, this chart shows how each pound received was spent by the CCG during the year, with 51 pence in every pound being spent on hospital, ambulance and transport services, 8p on mental health services, 10p on community services, 6p on continuing healthcare, 10p on prescribing, 11p on primary care services including national GP contracts, 1p on other programme services, 1p on CCG running costs and 2p on COVID costs. As the CCG moves into 21-22, we are working with our partners across Barnsley and South Yorkshire and Bassetlaw to ensure we commence recovery from the impact of the pandemic on health and care services, and also work to continue to deliver care close to home and the requirements of the NHS long-term plan. This is clearly a nationally challenging environment given the continued impact of COVID-19. However, the CCG remains committed to using the funding it receives to improve and deliver the best outcomes it possibly can for the people of Barnsley. Thank you for listening.
Hello, I'm Chris Edwards. I'm the Accountable Officer at Barnsley Clinical Commissioning Group. And I'd just like to take time to recognise all the amazing work in Barnsley over the last year, over the year 2021. The amazing response of all the GP practices, all the partners across Barnsley responding to the pandemic, delivering great services to the Barnsley population. What we found is all our partners worked together, they integrated at pace and they provided seamless services focusing on Barnsley's most vulnerable patients during the pandemic. The challenge for us now as we move to the next phase of the pandemic is about moving into a recovery phase and living with COVID. What we're seeing is an increase in demand for mental health services, and we're seeing increased waits for non-urgent surgery. And we're also seeing that patients are sometimes hesitant to access services when we'd wish them to, sometimes risk of missing early diagnosis of things like cancer. So what we need to do now is have a sharp focus on those going forward. The next thing I'd like to update on is the Barnsley CCG performance rating for 2021. The CCG received a rating of outstanding for the third year running, and it's a great dedication just to give to our staff and to our GP practices just for the brilliant work they've put in during the year. The next thing to update on is NHS reform. By April 2022, if legislation passes, we'd expect CCGs to transition into integrated care systems. We'd hope to maintain a strong Barnsley focus with a strong Barnsley partnership, and hopefully we'd see that Barnsley patients see great change, great improvements as part of this national approach. And finally, after a successful 2021, I'd just like to say thanks to all our partners, patients and staff and GP practices.